Hello, my name is Heidi Donovan. I am a professor of nursing and medicine at the University of Pittsburgh, where I also co-direct the National Rehabilitation Research and Training Center on Family Support. I have a long career of conducting research and also working in clinical practice to support families facing cancer. So much of my work has been in symptom management, and particularly symptom self-management, which is efforts to help individuals find strategies on their own to help manage their complications and side effects from cancer treatment or prevention. Today, I'm thrilled to be here to talk to you about why am I so tired, and thinking about how to manage fatigue that's due to cancer treatment or prevention. I have no financial disclosures and no actual or potential conflicts of interest relevant to this presentation. So what is cancer-related fatigue? The first thing to say is it is not the same thing as that everyday fatigue that many of us feel from time to time. Cancer-related fatigue is a distressing, persistent, and subjective sense of physical, emotional, cognitive tiredness, and even really exhaustion that's related to cancer or cancer treatment, and I would argue some types of prevention strategies that's not proportional to recent activity, doesn't respond to rest well, like most kinds of fatigue, and it interferes with all aspects of our functioning. So if you look at how people facing cancer describe cancer-related fatigue, it's things like these words here. It's debilitating, it's life-altering, it makes you feel drained, it's overwhelming, you feel exhausted, washed out, sometimes confused, makes you frustrated and upset and depressed, and it just makes you feel depleted. It really does affect all aspects of life. So how common is cancer-related fatigue? There have been many, many studies that look at fatigue prior to a cancer diagnosis, after a diagnosis, during treatment, after treatment, well into survivorship, and even some studies looking at fatigue after risk-reducing surgery. Primarily when I talk about that, I'll be talking about surgically induced menopause or even medically based early menopause. So if we look at a typical fatigue scale where a person would rate their fatigue on a scale of 0 to 10, where 0 is no fatigue and 10 is fatigue as bad as I can imagine, we generally say that fatigue of 4 or higher is considered moderate to severe fatigue. And in many studies, when looking at the incidence or prevalence of fatigue, we look at that number. How many people have moderate to severe fatigue? In that first year after diagnosis, it's almost universal. 70 to 100% of patients say they have moderate to severe fatigue. If you look longer term, so more than a year after diagnosis, the incidence is about 30 to 50% of people, which is huge to have this kind of overwhelming symptom that persists for that long. There's less research looking at fatigue after risk-reducing surgery. And so the findings aren't clear. In some studies, it looks like many women are not different than their age-matched cohorts in terms of fatigue, but there seems to be a small but significant number of individuals, about 20 to 30%, who for some reason have long-term persistent fatigue after risk-reducing surgery. I should say, as we move on, I had that ribbon there that cancer-related fatigue in all studies. I have never seen a study where looking at symptoms related to cancer and cancer treatment, where fatigue was not the number one most severe and most distressing symptom reported by patients. So why does this matter? And because I've just talked about how universal this all is, I'm going to talk about it as you. How does cancer-related fatigue affect your life? Well, it affects all parts of life. So when you're fatigued, you're less physically active, and that leads to losing strength and stamina in your muscles. It affects your social life. So you're not able to work, or you're less able to work less. And that has financial consequences, which leads to stress, which we'll talk about in a minute. Many people with cancer-related fatigue find that they have to change what they do in their family. So they're not able to do all the tasks that they used to do within their family, and that often triggers guilt. And then one of the most important things is people's worlds begin to narrow. They're unable to participate in valued activities. And when that happens, we sort of have less of a joy for life and can lead to depression and other sorts of problems. So then that brings us to the psychological impacts of fatigue. So we know that fatigue is closely related to anxiety, depression, guilt. People with fatigue actually don't sleep as well. And that lack of sleep then feeds into fatigue. And many people with cancer-related fatigue also report that they have cognitive problems, brain fog, chemo brain. And again, fatigue and cognitive problems are closely related. So fatigue affects all parts of your life. But then, as you can see, each of these different factors that are affected by fatigue create this vicious cycle where each one then contributes back to increasing fatigue. So it's a really important symptom to make sure we're not letting just go and accepting it as something we have to deal with. So let's talk about causes. And this is a difficult slide, but I'm going to walk you through this slowly. So there are many, many causes of cancer-related fatigue that are associated with having cancer, being worried about cancer, having prevention treatment for cancer, or the treatments of cancer. So all of these on here are related to that. I should say, though, that one of them here is other illnesses. So very few people come to cancer without other illnesses. So those comorbid conditions like diabetes, heart disease, infections, COPD, all those things themselves cause fatigue. But then let's also look at the cancer-related factors. So cancer in itself causes fatigue. It causes inflammation. Cancer tumors often release substances that cause inflammation that lead to fatigue. Cancer and its treatment lead to problems like anemia, dehydration, lack of appetite, kidney problems. All those things also affect fatigue. The treatments for cancer definitely affect fatigue. So chemo, radiation, immunotherapy, hormone therapy, and surgery all increase fatigue. Then people are often taking other meds while they're on treatment, right? So they may be taking opioids to manage their pain. Opioids make people feel tired. Antidepressants can also lead to fatigue, as can beta blockers and anti-anxiety meds. So you see all of these things coming in here together. So then people have physical and psychological symptoms while they're going through cancer: pain, shortness of breath, nausea. All those contribute to fatigue. And like I've already said, all these psychological factors go hand in hand with fatigue. So why is this important to know this? This is important because if you're experiencing fatigue that's persistent and sticks with you, you need to get it evaluated by a healthcare provider. And they should do a very detailed assessment of all of these factors that could be contributing to your fatigue that will guide their recommendations for how to treat your fatigue. And just as a sort of simpler way to think about the causes of cancer-related fatigue, think of things that just deplete you: poor nutrition and hydration, loss of strength and mobility, and poor sleep. Those deplete your energy stores. Stress, we all know how the stress of day-to-day life, throw in some depression and anxiety, and then about the worry of cancer. And you can imagine how stress can begin to drain us of energy. illness, all these cancer and other chronic conditions and their treatment can play into the fatigue. And then daily life, right? Life doesn't stop just because you have cancer. So all those things that cause those of us without cancer fatigue, jobs, kids, bills, housekeeping, all those things continue while you have cancer. I just want to stop here for a moment because we don't talk very much about fatigue for those who have prevented cancer, who've gone through risk-reducing surgery and still feel like they're fatigued and they feel like it started after their surgery. So the cause isn't clear, but we do know that the removal of ovaries is associated with inflammatory processes. So cytokines, and other sorts of substances are released that cause the systemic inflammation. And that's because the estrogen is taken away, and estrogen is known to prevent these inflammatory processes. There's good research that systemic inflammation is related to fatigue, and chronic inflammation is also associated with a wide range of chronic diseases. So like I said earlier, most people over time, their body comes back to sort of a state of homeostasis and the inflammation goes away and they don't have persistent cancer prevention related fatigue. But for a small minority, 20 to 30%, there is evidence that persists and the fatigue persists. So I think it's important, again, to know that if you have this, it needs to be evaluated and treated. All right, so now I'd like to talk about what do we do about cancer-related fatigue? What works? So I'm going to go over 7 different strategies and the literature for them to give you some suggestions about things that might be useful for you. So we're going to look at monitoring your symptoms on your own and why that's important. We'll talk about exercise, meds and supplements, acupuncture, diet, sleep, and then what we call the 4 Ps. So first of all, management. So one of the first things I always tell people with cancer or after cancer is that if you have a problem that's bothering you, the first thing you should do is begin to monitor it and be purposeful about it. I like people to think about these 5 very important dimensions of a symptom and why we think about them and how it can help you and your healthcare provider help you manage the symptom better. So first of all, we talk about the identity of the symptom. So how bad is it? What does it feel like? So how bad is it is on that 0 to 10 scale, or you can do from, mild, moderate to severe, anything that's systematic for you that you can sustain over time. In terms of cause, it's really important for you to think about when you get tired, what caused it, what triggered it, what makes it worse, and what are things that you feel like makes it better? When is it that you feel like, oh, I'm not as tired as I was? I wonder why that is. Think about the timeline. Is it constant? Are you always fatigued, or does it come and go? Are there times of day that are better or worse? And then think a little bit about consequences. How does the fatigue affect your life? What have you given up because of the fatigue? And then finally, emotions. How does fatigue affect you emotionally? And why is this thinking important? This is important because it allows you to think also about triggers and how you might manage them. But more importantly, 2 things. It sort of makes you realize when it's time to seek help, and it gives you the tools to communicate more effectively with your healthcare provider as you go in to be evaluated. And we say that fatigue that's persistently 4 or higher needs evaluation, because at that level, it starts to interfere with your daily life and your emotions. So here's a typical fatigue diary. It captures these dimensions I talked about. You can write down the day and the time when you're noticing that, the severity, how it feels, what's triggered it, and what you've done to manage it and how those things have worked. And these are nice things to be able to share with the provider. Okay, so now let's talk about management strategies. The first one, and we're always looking for a silver bullet, and I know we always hope it would come in a pill form or we could just take it and be done with it. But in this case, we do have a silver bullet, and that's exercise. The evidence is clear. Exercise in cancer patients and the general population, pretty much anybody you look at, exercise increases your energy, it increases your well-being, it increases your outlook on life, it increases your strength, your flexibility, your balance, reduces your risk for falls, and it decreases symptoms. It decreases fatigue, but we also know it helps pain and it helps depression and so many other things. And that's because exercise is the best thing we know to decrease systemic inflammation, one of the major drivers of fatigue. So, what exercise is best? So, there's good research that shows a combination of activities is the best for reducing fatigue. So, the first is cardiovascular or aerobic exercise. That is any kind of exercise that gets your heart rate up. It could be walking briskly, it could be light jogging, it could be biking, it could be swimming, it could be yard work or work around the house, that anything that's getting your heart rate up. 30 minutes a day significantly reduces fatigue for people with cancer, after cancer. And it doesn't have to be all at once. You can break it up into small pieces during the day. The next piece of evidence is around the benefit of strength and resistance training. Anything that gets the muscles moving, that is resistance, that really builds up the bulk of muscles. And that really should be done just 2 to 3 days a week. And it has its own independent benefits on improving fatigue. And then finally, stretching and flexibility. And here I would give a nod to things like yoga or mindful-based walking, where your goal is on stretching and flexibility. And that alone sort of helps mobility. It reduces the aches and pains in joints and muscles. But as importantly, it reduces stress. And as we've said over and over, stress is directly related to fatigue. So I know what everyone's saying is how do I start when I'm already so tired, right? It's such a paradox, right? When we're so tired, our body naturally wants to sleep, wants to rest, wants to nap. But again, there is such good evidence that just getting moving is the single most important thing you can do if you're suffering from fatigue. So the first thing is talk with your healthcare team. What is safe? Is it safe for you to start exercising now? Are there activities that you should avoid? That's an important conversation to have. Next, pick exercise that fits your life and that you like. If it's walking, that's always the easiest place to start. Set realistic goals, right? If you've been housebound for 3 months, you can't set goals of jogging for 30 minutes every day of the week. Start small, build on your early successes. So maybe the first is that you just make sure that you're moving more in the house. You're sitting less. You set a timer to get up every 15 minutes and do a little bit of movement. Then maybe after that, and a week later, you can walk to the mailbox. Then the next week down the street, next week around the block. And one of my biggest recommendations is find a consistent partner that will both hold you accountable, but maybe more importantly, provide social support and laughter and fun along the way, because all of those things work together to sort of restock our energy. Okay, so moving on from exercise, the next is medicines. People are always wondering, is there a medication that will help me manage this persistent fatigue that I've not been able to beat? So here the evidence is not great. So, and to be honest, most of these strategies have been studied in people with advanced cancer who, as a result of the cancer itself, have overwhelming fatigue that is keeping them really in bed and not able to participate in life activities. So in these studies, psychostimulants have been studied. So these are things like methylphenidate or Ritalin, and others in that class. So in this, and this is a good example of the difficulty in finding medication. So there have been 19 double-blind, placebo, randomized controlled trials that have been done looking at psychostimulants in advanced cancer. 15 of those showed no difference from placebo in reducing fatigue. However, 4 of them, and 3 with methylphenidate, showed improved fatigue compared to placebo in patients with advanced cancer. So some promising indication, and certainly if this is a situation that's relevant to you, it's definitely worth a conversation with your healthcare provider. Antidepressants have been looked at as a treatment for fatigue, and what we find is that they do reduce depression. So, over time that may have an indirect effect on fatigue, but in these trials, the antidepressants don't show benefit over placebo for fatigue. And then finally, steroids like dexamethasone and methylprednisone have shown benefit in patients with advanced or metastatic cancer. So these are, so again, in these situations, these are good for short-term use to help people with the kind of fatigue that is really just keeping them in the home and not able to do valued activities. But as many of you know, steroids are not recommended for long-term use. What about supplements? There's been a lot of interest in nutritional and other types of supplements that could sort of restore things that are lost through the course of cancer treatment or just day-to-day life. I've included 4 here that are a combination of things that have some evidence, but also things that don't have evidence but have gotten a lot of press lately. So the first one is L-carnitine. It's, again, a supplement naturally occurring in our body. And there has been some studies that have looked at L-carnitine and its impact on fatigue. So most of the studies don't show evidence for the benefits of L-carnitine, but there was a study that looked at subgroups and the effects of L-carnitine on fatigue. And what they found was that in advanced cancer patients who had a known L-carnitine deficiency had improved fatigue when given L-carnitine as a supplement. So again, something to talk about with a trusted physician or nurse or integrative care medicine provider who can do these kinds of evaluations and decide whether it's right for you. Coenzyme Q has gotten a lot of press, but there really is no evidence for its benefit in reducing fatigue. Wisconsin ginseng actually does have some benefit. There's a large, well-designed study of patients who are on or recently completed initial treatment, and they found that 2,000 milligrams per day significantly decreased fatigue, especially for those who are on treatment, but also for those who are off. The biggest problem with ginseng is that because it's not regulated by the FDA, there's not a standardization in dose or quality. So again, talk to a trusted cancer provider, cancer pharmacist, cancer integrative medicine provider to talk about whether this might be right for you and the right dose and brand. Finally, mistletoe extract, not mistletoe itself, which is highly toxic to humans, but mistletoe extract. There is some evidence for benefit. Again, this is one where we have to be careful with the quality and the standardization of the mistletoe extract. And so this, again, just highlighting before we go on, that in these, anytime you're adding a medicine or a supplement or a vitamins, you have to talk to your cancer care provider because these things can interact with your treatment or even the cancer itself. Okay, let's move on to others. So acupuncture has shown benefit for cancer-related fatigue in what's called a meta-analysis. So it's a systematic review of many randomized clinical trials. And in the most recently updated meta-analysis, they did find evidence that 20 to 30-minute sessions 3 times a week for 2 to 3 weeks, and then decreasing in frequency after that, significantly improved fatigue compared to looking at trials with sham fatigue or no treatment control. So that has some promise. Again, talk to your integrative medicine providers. There is some concern in acupuncture about side effects like infection, bleeding, bruising, or dizziness. Diet is always an important thing to look at when you're fatigued. And really, most of the evidence is around a Mediterranean diet. It is the best anti-inflammatory diet. It's plant-based. So 2/3 of the plate should be veggies, fruits, whole grains, and legumes. Lean proteins are recommended, chicken or fish. You limit salt and saturated fats and sugars and processed foods. I should add here that a key part of the Mediterranean diet is healthy fats. So oils like olive oil, canola oils, avocados, avocado oils, and the oils that naturally occur in nuts. So really making a distinction between bad fats and good fats. And then any sort of diet should always be supplemented with water, water, water. Next one is sleep hygiene. I'll go through this pretty quickly, but everybody who's suffering from fatigue should ensure that they have a good sleep routine. So a constant sleep and wake time each day, limiting naps to short 20 to 30-minute naps, and a routine to unwind. No stimulants in the evening. That includes caffeine, alcohol, exercise, and screen time. These are all stimulants. Find soothing activities like quiet music, reading, and stretching before your bedtime. And then make sure you're in a good environment that's dark, cool, quiet, with comfy clothes. Make a time to set aside your worries at night. Place them on a list for the next morning so you don't worry about the worry. And then practice evening gratitude. There's increasing evidence that spending a little bit of time every day thinking about what we're grateful for can elevate mood, and that again leads directly back to fatigue. The last one I want to talk about is the 4 Ps. This has been a long time tool of oncology nurses to help people with cancer-related fatigue, and it's all around prioritizing, planning ahead, pacing yourself, and positioning to make sure you keep your energy bank stocked up. So for prioritizing, really the goal is to conserve energy for tasks that lift you up, fill up your energy bank. So what do you have to do, and what is most important to you, and what can you get rid of it, and who can take those things that you can get rid of. Plan ahead, be realistic. Break down big tasks into small ones, manage your schedule. Don't say yes to everything, keep things off of it. Take power naps, plan them into your schedule, and simplify your life wherever you can. Pace yourself. That means planning for the long haul, both during an individual day, but over the week. Really what we're trying to do here is watch for warning signs that you are starting to deplete your energy bank. Right? So take it slow, and just break up things during the day. In terms of positioning, the last one, so pay attention to your body when you're working, and your body position can make a huge difference on how much energy it takes to do tasks. So think of laundry. You could stand up, bend over multiple times into the laundry basket, stand up to fold with your arms out, or you could pour the laundry onto the couch, sit down, and fold it in your lap. And the difference between the amount of energy you use there versus standing up is quite different. So I'm going to finish up here. I've given you a lot of strategies, but I'm going to add a 5th P, which is perspective. Cancer-related fatigue is a medical condition. It deserves to be evaluated and treated like any other complication of cancer treatment or prevention. You deserve to be heard. Be gentle with yourself. You didn't cause this. This is a consequence of treatment, and you're the one that's dealing with it. So don't feel guilty about what you're not doing for others. Let other people help you and build you up. Lastly, focus on activities and people who lift you up, who build up your energy stores. Let go of those activities and people who bring you down. And then finally, for most people, I can offer you hope that this will get better over time. So thank you for giving me this opportunity to talk with you today. I look forward to hearing from you, maybe during our panel session, or feel free to email me if you have questions. Thank you.